diagnosed with cancer would apply for this under your bill?
Absolutely. As it relates to the legislation and how a person in this situation would apply, they would have to be a firefighter who is labeled or who is designated as disabled as a result of a specified type of cancer as presumed for the purposes of laws governing the workers' compensation program. So it would be through the Department of Workers' Compensation that they would access these types of benefits. And it also would be, the burden of proof would shift from the employee to the employer at that point, which would be the state of Ohio. And they would be able to dispute if there was not affirmative evidence that that was the case. That's why the preventative screening is so essential, because we both want to protect the individual who might be prone to cancer occurrence, and also the state from hiring somebody who is likely to occur in the state of cancer and develop that cancer in the process.
And is there a set dollar amount of how much people can apply for? As you said, it would be something around $40,000 per firefighter. Could it be more or less?
Those are the estimates that we've received from the Police and Fire Pension Program, estimated off of previous legislation that was actually less conservative than ours in nature. It was based off of 3 years of hazardous duty. Our bill calls for 5 years of hazardous duty before they could apply, so it may be seemingly different, but we're not sure to what extent yet. We're still waiting on those numbers to be returned.
So is this bill different from SB 27?
Yes, this legislation is different. Mark, if you want to help explain the differences as well. But I think the main differential is that we have a preventative measure included in our legislation. The screening, I cannot reiterate, is substantially important to the process of helping to protect the state and the employee from being in a hazardous scenario that is harmful to their health. That is unique to our legislation. It's not something that's been in any other type of legislation relating to presumptive care. We believe in taking care of the front end and the back of the employee and the state. And then also the types of cancers that are listed, or the types of combustible materials that are listed, are unique to our legislation. If you want to speak to that at all, Mark.
I think it's an important note to understand about the screening. The screening is not just for the state or the employer. The screening also protects that employee. We're talking very early recognition if there's anything going on. It also would not prevent any department from hiring such an employee. It is just a pre-screening process. But the main difference in Senate Bill 27 is the amount of cancers that are medically linked to firefighting, and then covering not just the cancers, but the chemicals that are involved in such exposures. That's what makes us much more different.
And how would this be applied to current firefighters? Would they also have to undergo this screening?
We actually crafted legislation so current firefighters would be grandfathered so that that cost would not be applied to the local department or the employee at that point. Unfortunately, it would be far too difficult to go through that screening for all of the existing. And I think it would also put employees in a circumstance where if they had indeed contracted cancer while on the job, it would put them at a disadvantage to the state at that point, because it would say they had a pre-existing condition when that wasn't the case. So we believe that this is the right thing to do for new hires.
But would the existing firefighters be able to access these benefits then?
Yes.
Correct. You'd be able to access at any point in time once you have over that 60 months or 5 years of active duty.
How many other states have this?
35 currently right now.